most important thing before we talk about chronic pain is that you know that I know that the pain is very real. First and foremost, everything you're experiencing is real. That is so important. There's a lot of science behind pain, and at times it can feel dismissive. People might say things like, oh, it's just all in your head. Well, here's the thing. All pain is actually in our head. And so it's very true that you can have a real physical injury and no pain, and no physical injury and extreme pain. These signals seem to get mixed. And so with chronic pain, what we're looking at is more of a neural circuit disorder. And so this can happen from a real acute injury, or it can happen suddenly and unexpectedly, which can be very scary. And so using this model, what we look at is how do we break the pattern and bring safety into the body. So if we're looking at a structural concern or an acute injury, you have an injury. Then you might have a part that's really scared and stressed out and angry and anxious about the injury. So you're focusing. This tells the brain, danger, danger, alert, this is really scary, this is really big, this is really dangerous. So the pain gets bigger. Well, then the anxiety, the fear, the danger gets louder. Go, no, I have to fix it, I'm going to go try to do everything I can to get rid of this pain. So the brain goes, oh, you think this is really bad? Okay, let's amplify the pain. And so these neural circuits start to fuse together. And you may have heard before, what? If fires together, wires together. And so now we have this pain fear response where one each activates the other. And so now you may have had this acute injury and it may be past the healing period and it may have actually fully recovered, but you're still having symptoms. You're still having pain and it's confusing. And so what we do with things like internal family systems therapy and pain reprocessing therapy, and also with yoga therapy, is we look at how we can bring safety into the body and break those patterns. And also how we distinguish between what is actually neural circuit pain, which is being only from the brain, and what might actually need a little bit more physical support. What's important about this is that you're always checking in with your doctor, and you have ruled out any possible diagnosis or concern or serious condition before you do this therapy. What we don't want is you coming in thinking something is neural circuit when it could be more dangerous. And so once we have established that what we're working at is this circuitry, it gives us a lot of opportunities to change it. And so we may do things like somatic tracking. So noticing places of safety within the body or graded exposure, bringing in movement and reconditioning the brain for safety. We could also do things like trigger testing, where we actually purposely activate the pain and go through this series of steps where we can calm the nervous system. Now, through an IFS lens or internal family system lens, we might also look at the parts that might be pushing the pain. It can be a way to distract from bigger emotional experiences. If you're focused on your leg, maybe you're not so focused on that thing that's happening at work, or that relationship, or that thing that happened 10 years ago. And so there's a lot of ways in with chronic pain, and there's a lot we can do to help support it. And it is evidence-based, and there's a lot of really great growing research, which is showing that all of these approaches can be really supportive, and not only helping you out of your chronic pain, but actually healing from it. It's always going to go at the pace where you're ready to go with it. So we start with where you're at, and then we grow from there. If you've been listening to this and nodding along, or it sounds like something that's resonating with you, you might even notice that there's a little bit of emotion that's coming up as we're talking about it. Please reach out. We can have a quick 20-minute consultation or a conversation about where we go next. You're not alone, and there is a way out.